Good afternoon. My name is Megan Jones and I will be presenting information on prostate health. The first topic of the session will include prostatitis. The picture on the left shows a normal prostate. The picture on the right shows an enlarged prostate. Prostatitis is an acute or chronic inflammatory process of the prostate, usually due to a bacterial infection. It is typically caused by gram-negative rods such as E. coli or Pseudomonas. Diagnosis is on urinalysis, rectal exam, and a prostate antigen level. Signs and symptoms include penile and lower abdominal pain, fever, chills, voiding difficulties, and pain with voiding, and some obstruction that leads to retention. Penile warmth and tenderness, discharge, and increased PSA levels, blood, pus, and bacteria in urine. Treatment typically includes IV antibiotics for 24 to 48 hours, followed by oral antibiotics for 4 to 6 weeks. Chronic condition is typically caused by Enterococcus bacterial. Signs and symptoms are usually recurrent urinary tract infections and some voiding difficulties. Mostly no other symptoms are present. Treatment is Bactrim, Cipro, or erythromycin orally for other forms include non-bacterial, which is usually linked to chlamydia or viruses and has no history of recurrent urinary tract infections. Signs and symptoms are negative urine and blood cultures, but leukocytes are present, no change in PSA levels, and mild intermittent pain in groin or bladder area. Treatment is typically based upon presenting symptoms. Erythromycin for 14 days, ibuprofen, sitz baths, and Flomax to help relax the muscles to assist with urination are typically prescribed. Prostatinia is a non-inflammatory condition that affects young to middle-aged men. Signs and symptoms are bladder spasms, voiding difficulty, and treatment typically includes Flomax, warm baths, and Valium. The next topic of the session is benign prostatic hyperplasia. The picture on the left shows a normal prostate. The picture on the right shows an enlarged prostate. BPH is a non-cancerous abnormal cell growth that causes the prostate to enlarge. Occurrence and obstructive symptoms typically increase with age. For example, at age 50 to 60, 50% of individuals will have BPH, and at age 80, 90% of men will have BPH. Cell changes affiliated with increased levels of dihydrogen testosterone, which inhibits cell death and causes an overgrowth of cells, producing enlargement of prostate. Symptoms are typically divided into obstructive or irritative symptoms. Obstructive symptoms include trouble with starting or stopping urine, decreased force of stream, straining to urinate, feeling of full bladder, and urinating within 2 hours of previous urination. Irritative symptoms include strong or sudden urges to void, frequency that occurs especially at night. Diagnosis includes a physical exam, a digital rectal exam, a neuro exam, and a detailed urinary tract history. PSA levels, urinalysis, cytoscopy, and possibly a CT or renal ultrasound. The American Urological Association provides a questionnaire to evaluate severity of obstructive or irritative symptoms. Scores range from 0 to 35, and they indicate increased symptoms with increasing number. The BPH Impact Index also assesses the impact and interference of condition on everyday activities. Treatment of BPH typically includes pharmacological treatments such as alpha blockers like Flomax, alpha reductase inhibitors such as Proscar, a combination of alpha blockers plus the alpha reductase inhibitor, or an alpha blocker plus an anticholinergic, such as Detrol or Vistaril. also Cialis. Surgical, the most common is the TURP, transurethral resection of the prostate. Another form is the open prostatectomy. Another form is the TULIP, a transurethral laser-induced prostatectomy. Prostate cancer. This typically caused from adenocarcinomas that develop from mutated cells that either inhibit tumor suppressor cells or cause cells to continue to rapidly grow and divide. Risk factors of cancer typically include men greater than age 60, African American, or individuals with fathers or brothers with prostate cancer. Signs and symptoms include voiding difficulties such as urgency and frequency, blood in urine, erectile dysfunction, pain to hips, back, or chest, and weakness to lower legs and feet. Diagnosis typically includes a medical and physical exam, a transurethral ultrasound, a digital rectal exam, a prostate-specific antigen level greater than 5 typically indicates prostate cancer and assists with the staging of cancer. An additional staging tool utilized is the Gleason score, ranging from 2 to 10. Higher levels indicate further spread of cancer outside of the prostate. The only way to confirm prostate cancer is through a biopsy. Prostate cancer staging is divided into 4 stages and determined by location of cancer with or without lymph node involvement, a Gleason score, and a PSA level. There are a variety of treatment options for prostate cancer. It typically includes chemotherapy, radiation, chirotherapy, hormonal therapy, and a vaccine. Also, there's treatment to prevent spread to bones or treatment if entered the bones. The last topic of discussion will be erectile and sexual dysfunction. Erectile dysfunction is defined as the consistent inability to attain or maintain a sufficiently rigid penile erection for sexual performance. Age range typically occurs from 40 to 70 years old. Causation is either loss of libido or loss of erection. Erectile dysfunction typically occurs from lack of nitric oxide or malfunction of biodilation of arteries. Some medications, such as hypertension medications, antidepressants, or pain meds, cause erectile dysfunction. Other sexual dysfunctions include Peyronie disease or penis curvation, priapism, which is an erection lasting more than 4 hours, anejaculation, retrograde ejaculation, or premature ejaculation. Erectile dysfunction diagnosis is done with medical and physical examination, including severity, type, and duration of penile issues, review of existing conditions such as heart and kidney diseases, current medications, use of alcohol and recreational drugs, and blood testing. Typical treatment is hormone replacement with testosterone, penile prosthetics, vacuum erection devices, arterial reconstruction, and correction of curved penises. Oral agents include Viagra, Cialis. Injections include prostaglandin with or without papaverine or regenetide. Patient education. At any time, consult your physician with any physical changes in the prostate, urinary difficulty, blood or pus or discharge from penis or in urine, sexual dysfunction, or recurrent urinary tract infections. Maintain a healthy diet, low fat, low dairy, and low meat. No greasy or spicy foods, moderation of alcohol, increase your fiber, vegetables, and fruit intake, and moderate exercise at least 3 times a week. Consult with your physician with any addition or changes in medications. Adhere to management of heart, kidney, and diabetic disorders that are associated with increased prostate and penile dysfunction. For any treatment plans, carefully discuss all alternatives, traditional and alternatives, side effects of all interventions, probability of success rates, effects on daily life with or without treatment. And prior to your visit, a good idea would be to create a question log that you can take with each visit to write down any questions or contact your doctor if you have any questions throughout the duration of your treatment. This concludes my presentation. Thank you for your time.